Simon, and I'm here today to tell you more about Ebola. Ebola has been hitting West Africa really hard in 2014. So far, over 4,000 people have died from the extremely infectious disease. I'm here today to tell you more about what you can do to protect yourself and prevent the disease from spreading further in the United States and protect the United States population. Ebola begins as a fever. Most people may think that they just have the flu. Symptoms will include inflammation of the throat and the eyes, and will then progress into nausea and diarrhea and abdominal pains. The more severe effects will begin to manifest after about 1 to 2 weeks. Skin will become very weakened, and simply just the touch of the skin could cause bleeding. Loss of blood is one of the many things that leads to death in Ebola, which has a 90% fatality rate. So far, 8 people have been treated in the United States for Ebola, and only 1 has died. That's because we have extremely good techniques on how to prevent the disease from spreading and how to treat the symptoms of Ebola, which are 90% of the time the reason why Ebola patients pass away. Ebola is systematic. This means that Ebola will attack everything in your body that is not muscle or bone. This includes tissue, which definitely leads to breakage of the skin. To conclude, Ebola is an extremely dangerous and horrible disease with effects that are almost always fatal. The current status of Ebola in the United States is very extreme in countries in West Africa, including Sierra Leone, Liberia, and Guinea. These 3 countries have been hit the hardest by the disease. There have also been cases reported in countries such as Spain, Nigeria, and it has even made its way into the United States. On September 30th, the first person was diagnosed with Ebola in the United States. This man, Thomas Duncan, was a man who had traveled to the United States before experiencing symptoms of Ebola. He was Liberian, and he flew into Dallas, Texas. 3 days later, he started to develop symptoms of Ebola and went to the hospital. The hospital was a Presbyterian hospital in Dallas, Texas, where they first turned him away. They told him that he was just experiencing symptoms of the flu, gave him some flu medicine, and sent him back home. 3 days later, he returned to the hospital in an ambulance, which is when they began to diagnose him for Ebola. Since then, the only other person who has been infected in the United States were 2 people, actually, were 2 of his nurses who were dealing with his bodily fluids, which is the only way that Ebola can spread, through bodily fluids including vomit, feces, sweat, and urine. And so it's a very positive sign that the only people that have been infected thus far were people who are trained to handle his bodily fluids. There are certain Center for Disease Control protocol that were not followed properly, and that is why the infection has spread to 2 Dallas nurses who are now being treated in Bethesda, Maryland, and Atlanta, Georgia. How to prevent Ebola. Ebola, like I said, spreads through the transmission of bodily fluids. Contracting Ebola is actually pretty difficult because it is not your average day when you find yourself cleaning up the bodily fluids of another individual, especially one that is infected with Ebola. Healthcare workers are trained on how to properly handle Ebola, and like I said, there was simply just a breach of protocol in Dallas. Gloves, masks, goggles, and gowns are all commonly known tools to be worn when treating an Ebola patient. The Center for Disease Control is working very hard to prevent the further spread of Ebola within the United States. If symptoms of this disease are not displayed within 21 days, then that means that anybody who has been exposed to this disease is clear. They are given the okay and do not have Ebola. So anybody exposed to the disease is put in kind of a quarantine where they are monitored and their temperature is checked twice a day for a 21-day incubation period. Overall, Ebola is a scary and extremely fatal disease with its 90% mortality rate. But the Center for Disease Control and other government organizations are doing their best to keep the citizens of the United States safe from the infection. The 2014 outbreak will come to an end, and Ebola will be just a scary thing of the past. Thank you.
Yay!